Colleagues, friends, members of the representative body, welcome. I could not begin this speech to you without first referring to the Deputy Council Chair, Kailash Chand, who stands down from that role and indeed from Council at the end of this meeting. Kailash is well known in his own right as a campaigner and commentator with both local and national profiles. Although he and I are different people in personality and approach, we have shared fundamental values on the things that really matter. His support and his efforts on behalf of the BMA do him and this association credit. Kailash, we thank you. So, welcome on this first day of the ARM. And in their surgeries and wards, in their clinics and laboratories, let's acknowledge the thousands of doctors for whom this is not the first day of their working week, but the 8th or the 9th. They're in work, Jeremy. "12 months ago, we told the government to get real, to strive for healthcare, not headlines, to find the funding, not conceal its need, to learn that dogma is no friend of good government and evidence no threat. But instead, we've seen this government waste a year in the aimless, damaging pursuit of a mantra, in needless dispute with the profession, in hapless denial of the truth, the evidence, and the lived experience of those who work in the health service. A wasted year. A year we'll never get back. A year we never want to repeat, and yet a year when we stood together as one profession against a mounting and shrill barrage of threats. It started with a line in a manifesto, a line about a truly 7-day NHS, a line that will mystify those who look back and ask what kind of government whips up a corrosive dispute on a principle with which doctors fundamentally agree. So, once again, let's be clear. We support patients getting the care they need when they need it. Of course we do. As doctors, how could we not? We don't need to be told, as the Prime Minister helpfully pointed out, that diseases don't work weekdays 9 to 5. And guess what, Mr. Cameron? Nor do we. We care for our patients every night, every weekend, when the windows of Whitehall are dark. And we have been leading in the redesign of services for years, long before that manifesto was written. 2 months after the election, the government still didn't have a clue what the policy was, but the Health Secretary was absolutely sure that we were a roadblock to achieving it. That was never true. The roadblock was the £22 billion hole in NHS finances in a service already resourced much less at weekends than during the week. Last August, we were the first to pose the key questions about this major policy. How will 7-day services be funded? How will they be staffed? How will weekday services be protected? The government couldn't miss them. We emblazoned them across national newspapers. We lobbied for answers in Parliament. But the government still couldn't answer them. It still hasn't. Instead of getting answers, we got the blame. 9 months later, the chair of the Public Accounts Committee said, "It beggars belief that such a major policy should be advanced with so flimsy a notion of how it will be funded." Quite. The public agrees. 2/3 in a survey we published yesterday think the government hasn't done enough to explain 7-day services. Just imagine, as a doctor, if you embarked on a radical new course of treatment but were unwilling or unable to justify your decisions. You wouldn't be a doctor much longer. Nor would you be fit to practice if you took such a partial and cursory view of the evidence. Please, Mr. Hunt, the weekend effect is a serious and complex topic, and not your flexible friend to wheel out when you need to bash some doctors. Confirmation bias can cost lives. Evidence isn't there to decorate rhetoric. It was then that the government crossed the road to pick a fight with the one group of doctors who, even by the standards of our 7-day-a-week, 24-hour-a-day profession, are conspicuous on the wards every evening and every weekend. Who on earth would launch its onslaught on the medical profession by having a go at junior doctors? I'll tell you who if you haven't guessed. A government that mistook a soundbite for a policy. A government always too willing to point the finger, always too slow to offer a hand. A government blinded by its own dogma, which made the fatal error of believing its own rhetoric. Junior doctors have never been told why they were singled out, why they should simply accept a contract that failed to protect them and their patients from unsafe hours, why they didn't deserve a contract that treated women fairly. Strikes are always a last resort, particularly for doctors, but we'll remember how junior doctors made every single one of those days a positive demonstration of why they cared and what they stood for. They showed unity in dispute and, just as importantly, a focus on the need for a negotiated agreement to resolve this dispute. Junior doctors pushed this to the point where they were finally listened to by government, and they were listened to because the government was in no doubt of our unity, our ability to organise, and the support we had from patients and the public. This was the year when a profession that can sometimes revel in its differences came together as never before. SAS doctors, consultants, GPs and medical students supporting junior doctors, covering their work during the industrial action and saying, as I did on the Today programme, I would have done the same. We are one profession. We must remain so. Junior doctors now have a contract offer that would not have been conceivable last October. Following more than 100 BMA roadshows at which the detail of the offer has been set out and junior doctor concerns heard, our members are now making up their own minds. Whatever happens with any future contract talks, the government has learned that it is dealing with a united profession. I hope it has learned how and how not to deal with one. This will be remembered as the year when the government grew obsessed with chasing an empty promise, when it should have been obsessed about a health service in financial crisis. But the government is in denial. The Chancellor says he has a fully funded plan for the NHS. But while he announced £10 billion of new money in November, our funding report showed the real increase in health spending is less than half that. As for the rest, for the largest part of the unmet need, the plan relies on what he laughably calls efficiency savings. We've seen those before. They are neither efficient nor are they savings. They are cuts. Year on year, cuts to funding that have driven almost every acute trust in England into deficit. In total, more than £2 billion in deficit, a 20-fold increase in 2 years. And this pernicious effect permeates every part of the United Kingdom. This from a government which promised to cut the deficit, not the NHS, from a Prime Minister who assured us that the NHS was safe in his hands. You don't make an organisation more efficient by paralysing its ability to invest, to adapt and to recruit. You don't make hospitals better at caring for patients when they're forced to care more about their financial survival. Here's a curious fact. There are more health ministers in England than there are major emergency departments that met the 4-hour waiting target. And elective waiting lists are at their highest in almost 10 years. When those hospitals look for support, they're told by their regulator they should cut staff numbers to help balance budgets. The Francis report told hospitals that staff numbers should be based on safe care, not about meeting financial targets. We know what can happen when this advice is ignored. Other cuts are made through a shoddy sleight of hand. The government said it wouldn't cut health spending in real terms, but it took £200 million from the public health budget by saying that promise only applied to the NHS, having put public health outside it. The Chancellor says he's cutting the Department of Health's Whitehall budget as if he were talking about paperclips. We've looked into what that budget actually pays for. A successful smoking cessation service in the North East is now under threat. In Brighton, the council says cuts to sexual health may lead to increased HIV prevalence. In Leicestershire, in Somerset, in East London, in Surrey and in Darlington, we have found similar stories. You can't trade a public health policy for an e-cigarette and crossed fingers. Health spending is a political choice, but it's a choice from which our government is hiding. We know that investment in healthcare mitigates health costs for individuals and improves the overall quality of life. It supports the provision of universal access to a comprehensive healthcare service. If health needs are not met by public health services, the costs do not disappear. Instead, they have to be borne by the population as a whole. And yet, our country spends a smaller share of its national wealth on healthcare than the European average. We know what kind of NHS we want for patients. Now the government needs to make the same choice. Does it really want to be remembered as the government where the waits got longer, the excuses got thinner, and the debt started to pile up? Or will it finally invest in the health service it promises, the one our patients rightly expect? The public no longer believes in that shiny fiction of a health service that gets rolled out on budget day and during elections. An independent survey we commissioned found that almost 80% are worried about the future of the health service, and 3/4 think the government is fueling discontent amongst NHS staff. Our campaign, An Urgent Prescription for General Practice, highlights the disastrous impact of these cuts on the workload of GPs and the care they can offer their patients. GPs offer millions more appointments than they did 10 years ago, yet during this time their funding has been cut from more than 10% of the NHS budget to less than 8%. It's a bizarre way to run a health service, attacking its very foundations. And more than 90% of GPs tell us their workload is impacted on their quality of care. No wonder half of practices have a GP with firm plans to leave in the next 12 months. But who knows? Maybe the massive erosion of funding for general practice isn't really a cut at all. Perhaps it's another of the government's efficiencies. I doubt, however, that patients find it efficient as they wait longer for appointments and GPs are driven from the profession. By misusing the word, by implying that those of us who see patients do so lackadaisically, this government has turned efficiency into a dirty word. GPs have sent the government the clearest possible message that it must meet the BMA's urgent prescription and commit to fair and sustainable funding, safer levels of workload and proper staffing. The government has made a belated pledge to increase funding, but it's inadequate. It will take far too many years into the future to deliver what is needed now. The government has yet to learn that repeating the same old empty claim doesn't bring about change. They can't conjure 7-day services out of thin air. And to take another tired old mantra, they can't convince us that privatisation is good for the health service, however much they repeat it. It's the small matter of the evidence again, you see. All we ask is that they look, listen and learn when millions of pounds have already been wasted on private provision in the health service. Learn from Hinchingbrooke, where a private company took over a troubled hospital predicting savings that were, in the words of the Public Accounts Committee, unachievable. Guess what? They were. Learn from Mid-Sussex, where a £235 million musculoskeletal contract was handed over to the private sector, and only after that did someone figure out the mortal threat it posed to the local hospital. Learn from Nottingham, where dermatology was transferred to a private provider, but most of the senior staff didn't follow, harming the service for patients for years to come. It's all in our report on privatisation, and so is another question the government has never been able to answer. Why don't private providers face the same requirements to report patient safety incidents and performance as NHS providers? There seems to be a blithe assumption that just by having shareholders, an organisation can care better for its patients. Well, we've got a group of shareholders too. It's every man, woman and child who uses the NHS. Private companies should be supporting our shareholders. It's not our job to support theirs. We are campaigning on many fronts. And with the same unity and focus we devote to the junior doctors to 7-day services, we've achieved real benefits for our members and our patients. We've protected children's health by successfully campaigning to ban smoking in cars where a child is present. This is law in England and Wales, will become law in Scotland, and is being considered in Northern Ireland. Every bad year for the tobacco industry is a good year for health. I'm sure you'll have shared my satisfaction last month when the overwhelming vote by MPs for plain packaging was upheld in the High Court. We even heard multinational tobacco companies talk about compensation. But of course, it was compensation to them for a devalued brand, as if they haven't devalued it enough themselves through peddling death and disability. In the past, we've been called eccentric or extreme when we've campaigned for smoke-free public places or a ban on advertising. Now, these policies are mainstream. More importantly, they save lives every day. The soft opt-out on organ donation in Wales, for which there was consistent and well-informed BMA lobbying, has already increased the number of available donors. We will continue to promote this policy for other UK countries. In Scotland, the BMA continues its battle for minimum alcohol pricing against powerful commercial interests. Surely the most powerful interest in any country should be that of improving people's health. Here in Northern Ireland, the BMA has spoken up eloquently on the funding shortfall, the need to recruit and retain its first-class medical workforce, and in the better integration of health and social care. We've carried out a major project to find out the public's and the profession's views on end-of-life care and physician-assisted dying, and you'll be discussing these issues in detail on Wednesday. The government has at last realised that its chummy and voluntary approach with the food and drink industry is no way to tackle the obesity crisis. The tax on sugary drinks, for which we called in our Food for Thought report, is a welcome start. But as the report shows, there is much more that needs to be done to tackle this serious epidemic. We've achieved significant victories for overseas doctors and medical students, winning changes to visa rules that placed unfair burdens on those who want to study here or contribute to the National Health Service. And in the year ahead, we have major pieces of work on child health and on the impact of austerity. That's why I'm so proud to be one of the 170,000 members of the BMA. Our wins for doctors are wins for patients too. Colleagues, we meet here in Belfast at a crucial moment in our membership of the European Union, or if you're watching this on repeat, perhaps at a crucial moment in our membership of the North American Free Trade Agreement. I hope you've made your own voting arrangements, because the decision that confronts us on Thursday will have profound consequences for healthcare in the United Kingdom. We haven't told BMA members how to vote on this issue. I, like you, have my personal views, and I think we can agree, as the BMA in Europe Guide pointed out, on how many ways our lives are touched by EU membership. We were the first national medical association to have an office in Brussels, and we've lobbied on a wide range of issues for more than 20 years. Where none of us can be neutral, however, is in condemning the farcical and fatuous claims that have been a byproduct of the political campaigns. We've warned before about politicians playing games with the health service. Here we see game playing on a truly continental scale. That promise of billions of pounds of extra NHS funding if we leave the European Union, it's beyond irresponsible. It relies on the unknowable assumption that the United Kingdom's economy will be the same size and the money would still be available. It's a promise that has been proven to be based on fantasy figures, but it is maintained as a slogan designed to deceive. And further, do we really believe that some of the most ardent, fanatical and dogmatic supporters of austerity are suddenly desperate to increase public spending if only they had the chance? That the only thing holding them back from investing in the people's health before now has been saving it up as a mammoth bribe? Instead, we have a promise made by senior politicians of money they don't know they can find and probably no inclination to spend if they stumbled across it. The NHS deserves better than that. It's not a logo to misuse on a leaflet or a bus. Worse even than that. There have been truly unsettling insinuations directed against tens of thousands of our members and the people with whom we live, work and study, who make the fabric of our NHS and our nation. It has been implied that those who come to this country take from us or threaten us. Close our borders has been the call. Keep out the Europeans. And while we're at it, people from beyond Europe's borders, whether seeking refuge or with much to offer our society, or both. In one campaign advert, we see a waiting room in one of our hospitals. It's calm, half empty. The suggestion being that's what the country would be like with fewer immigrants. Well, in that little England, good luck with finding enough doctors or enough nurses. Anyone who attacks the contribution to this country of people from around this world attacks us all. They attack many of us personally, but they attack every one of us because the health service we love would not exist without their contribution. We are one profession, and that means you who trained in India, you from Pakistan, from Nigeria, from Poland, from Germany, from South Africa, from every single country that makes the world's greatest health service a health service that the world has built. The health service would be poorer without you. There might not even be a health service without you. Colleagues, our unity makes us strong enough to fight for the quality of patient care. It allows us to speak with authority and to know we will be heard. It's what turns a group of individuals into a profession, one profession. We can be no other. Thank you.